According to Jan Willem Brugging, in 2012, about 20% of people between the ages of 16 to 30 reported that they were contact lens wearers. As we age, our eyesight gets worse generally, so it's safe to assume that many of us throughout our lifetime at some point will experience wearing contacts. I've been wearing contacts for 7+ years, I'd say about 5 to 6 times a week, and I've never had any issues, and I'm thankful for that. Today I want to talk about the right way to put in contacts, as well as the proper way to wear them, and more specifically how to insert contacts into the eye and some things to avoid while wearing them. So the first thing I want to talk about is contact lenses can cause eye infections. Irregular replacement and improper cleaning will increase the risk of eye infection. And what I mean by irregular replacement, for example, is I have daily contacts. So that means I'm supposed to wear them 1 time per day and then dispose of them at night. So if I wore these for 2 or 3 days in a row, that would be irregular replacement because I'm not supposed to. And according to the Center for Disease Control and Prevention, in 2018, keratitis is a common painful eye infection that causes 1 million hospital and doctor visits per year. So one way to minimize the risk of infection is to always make sure your hands are clean. So I'm going to wash my hands before I put them in. It's important to always wash your hands before you put in your contacts or take them out. And the reason is because the bacteria on your hands will get onto the contact lens, and then that will be put into the eye, which is not good, and that will increase the risk of infection. So you want to pinch your eye, just put it right on, make sure you clean it. Anything to reduce the risk of infection. So once the contacts are in, there are some things that you should avoid doing in everyday life. These are activities that would increase the chance of getting eye infection. The first one is rubbing your eyes excessively. When you rub your eyes excessively, you're at risk of damaging your cornea, and that can cause blurry vision. Another thing you shouldn't do is overwear your contacts, because when you overwear your contacts, you deprive your eyes of oxygen, and that can increase the risk of infection. And another big one that I've done and many people have done that you're not supposed to do is to sleep in your contacts, because that not only deprives your eyes of oxygen, but it also causes inflammation and dryness. So if you follow these steps above that I've talked about, that will increase the chance that your eyes will be healthy while wearing contacts. So in conclusion, I've talked about the right way to wear contacts and the right way to put them in, and the importance of cleanliness and how to reduce the risk of eye infection. And throughout my life, I've worn contacts numerous times and I've never had any issues, so I hope that continues.